Nearly 40 million Americans provide unpaid care to loved ones suffering from a debilitating illness. On tonight's edition of The Best Times, we discuss the world of caring and caregivers. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people since 1964. Additional funding is provided by the members of WKNO. Thank you. Hello, I'm Chris Hardaway. Welcome to this edition of The Best Times, a series that looks at life after 50. A few years ago, my mother fell ill with Alzheimer's. I watched as she slowly disappeared, and I watched as my father cared for her. When the burden became too much, we hired a caregiver to come in 2 or 3 times a week just to give my father a break. But that only lasted a few weeks. My mother's health deteriorated. We moved her to an assisted living facility, and shortly after that, a nursing home. My father was with her every day until the end. This story isn't unusual. It's repeated thousands of times every year. And as the baby boom generation ages, it will be repeated millions more. Tonight on The Best Times, we examine the landscape of caring and caregivers. There are over 15,000 nursing homes like this one in America, with capacity for 1.7 million residents. At any given time, 1.4 million Americans are living in nursing homes. Nearly 40 million Americans will provide unpaid care to someone 65 plus this year. Nationwide, the economic value of this care is put at $450 billion. The average caregiver in America is a 49-year-old woman caring for her 69-year-old mother. She's been caring for Mom for the last 4 years, about 24 hours each week. According to federal government estimates, 70% of Americans over 65 will require long-term care for a period of at least 3 years. There is a high probability that everyone will need care or become a caregiver at some point in their life. We've invited 4 experts into the studio to discuss the issue of caring and caregivers. Dr. Mona Wicks is a professor in the College of Nursing at the University of Tennessee Health Science Center. Dr. Clay Jackson is medical director of Methodist Hospice and Palliative Care. J.J. Dowdy is assistant executive director of Alzheimer's Day Services. And Miriam Clay is Manager of Programs and Education with the Alzheimer's Association. Well, let's begin at the beginning by defining who the caregivers are. Who are they?
So much of what we know about caregiving occurs in the context of dementia. So we know that many American families are touched by Alzheimer's disease and other dementias. If you look at the National Alliance for Caregiving and the AARP studies that are done about every 5 years at the national level, that's what the data show us. We also know that most caregivers, about 60%, are women. We also know that the number of men who are caregivers is growing exponentially. When I started in this area, 78%, 80% of caregivers were women. Now it's 60%, so the gap is narrowing. We know that the typical caregiver is a female, older, middle age to older. We know that it occurs in all ethnic groups, with about 70% or more being Caucasian, 13% being African American, and then the other ethnic minority groups fall in line. We know that it touches all families at some time, or most families at some time. We know that it affects across socioeconomic statuses, so it touches everybody.
Everyone.
It touches
Everyone's
everyone.
a caregiver. What kind of care do caregivers give?
Wow. Emotional care, just giving yourself emotionally. A lot of times we'll see with caregivers at the Alzheimer's Association that they will completely forget about themselves emotionally, physically, mentally, to where we'll be concerned about their health. They could have been a very healthy individual in the beginning, but as the caregiving journey progresses with their loved one, especially with dementia, their health a lot of times decline, and it starts with the loss of taking care of themselves emotionally.
Well, what makes it so hard? I read an interview with a gentleman who had cancer, and he had fought the battle and won, and then he became a cancer caregiver. And he said, by far, the role of a caregiver was harder than battling the disease itself. What makes caregiving so hard?
Well, I think one of the things about that is that you are thrust into caregiving without any
It's not your choice.
It's not your choice. It's not, you haven't gotten any education on it. You are just thrust into it, and you're going, oh my goodness, what do I do? And I'm trying my best, but I'm not sure what's going on with her or him, and I'm responsible for that. So there's a lot of education that needs to be given, and support that needs to be given to that caregiver, because all of a sudden you're in the middle of it without knowing what to do or how to proceed.
And then there's also the situation, isn't there, where you have, let's say, a sibling, a younger sibling, taking care of a parent. And they're caught not just thrown into this situation, as you say, without choice, but also they have to deal with their own lives. They may have children to still raise. They may have
the
a job.
sandwich generation, that they're caring for the little ones and still have raising their own family, trying to provide for that family, and then here they're thrust, given their parents. And a lot of times we call it a 36-hour day. In fact, that is our Bible.
Yeah, I've read someone said in that situation, a sibling taking care of her mother, she said, I've had to put my life on hold.
You really do.
Common response that you hear?
Yes.
Well, JJ, I think that you bring up a number of good points, and I think there are other societal factors that come into play as well. You know, in pre-modern agrarian society, families tended to be nuclear, and there were a number of siblings that lived within the local community, and so caregiving could be shared among the organic family. With a much more mobile society, there are advantages in that people can choose in which area of the country they'd like to live, or even the world. We do have the geographic dispersal problem where families live far apart. I think also there's a psychological issue that comes into play with caregiving, in that we are accustomed to having sort of battles of autonomy and the will with our children. And so there's famously, you can't go play in the street, you can't drive the car, you can't manage the checkbook yet. We are not accustomed to playing those battles of will with our parents or our spouses. I think the final thing that comes into play with our caregiving is a concept that Cicely Saunders, the founder of the hospice movement, her phrase that she coined, and that was total care for total pain. It's not only the emotional commitment, Miriam, it's a total commitment. I mean, it's a personal care that perhaps may never have been done. A child may never have they've had to change their children's undergarments, but never their moms or their dads. And so there are emotional and physical barriers that are broken down, and it is constant. It is a 24/7 job without rest. Even during sleeping, caregivers often sleep less fully or less deeply or less restfully, because they're listening all of the time to see if mom or dad has fallen or if mom or dad has gotten up. And so the lack of a break is very, very difficult.
Well, let's
for many
talk
of our
about, we
families.
touched on health issues earlier, but let's talk about that in general, because health issues among caregivers, that's a big issue.
Yes,
I mean, you've done studies on that, correct?
Right. So we know that caregivers experience more depression,
Yes.
We know that they experience more anxiety,
Yes.
sleep disturbances. There's even some data suggests that it affects their immune systems as well, so
That's
that they
true.
get more colds, more the flu, that kind of thing. And because they don't go, as Miriam said, they don't go to the doctor for preventive health care, then they're at risk. They're at risk for all kinds of problems, and not sleeping creates all kinds of risk in terms of health outcomes. So, I mean, they have problems, mental, physical, emotional, and so it can take a toll on caregivers.
Does guilt play a role
Oh,
in this?
sure it does.
Oh, yes.
Oh, sure it does.
I think you're never doing enough.
Yeah.
You know, something happens and you can have a great day, and then all of a sudden
Right.
something changes it, and you blame yourself as
Right.
a caregiver.
Right.
You know, I've read that caregiving is like a marathon. Would you agree? Is that an accurate
Absolutely.
statement?
Very.
Go ahead.
Have you found in your research, because the statistics say that one in, like 1/5 of caregivers die before the person that they are caring for?
In my own research, I have not observed that, but in reading the literature, it's true that the mortality rate for caregivers is much higher than for non-caregivers. We do know that.
It
as
does
well.
depend on the illness. In
It does.
Alzheimer's dementia, which tends to be more of a total care phenomenon, with the emotional and the cognitive problems for the person who's being cared for, mortality can be actually greater for caregivers than it is for the one receiving care. And so it's actually shocking that a person could have a terminal illness and yet the person caring for them could die earlier. And this is where we get into the frail, taking care of the frail,
Yeah, the old
because
taking
the
care of the old.
emotional and physical needs of caring for that person are so stressful.
Well,
that
it's
it
like the
could
case
result
with
in
my mother and father. Both were in their 80s. And, you know, fortunately, my father was in very good health, and he could handle it. He's still in good health. But yeah, I can easily see with the old taking care of the old that mortality among caregivers has got to be a huge issue when you consider the physical impact, the emotional impact, financial impact, all of that together, health impact, obviously. Well, I want to clear up some myths, okay? 37% of people say that they believe that Medicare will pay for long-term care, will even pay for in-home aides to come in. That's not true, is it?
I can speak from adult day programs. It does not cover at all adult day programs.
And if you look at the data, the data in those large national studies show that much of the weight of caregiving falls on the family. And it's saving the healthcare system billions of dollars. So it's not true, because if it were true, those data wouldn't exist.
So what does caregiving really cost? I mean, financially, the economic cost of it.
Well, I can't put a number on it, but I can tell you this. There are all kinds of costs. It's the cost of taking care of the person in the home. It's the cost of missing a day from work for the caregiver, or, you know, not taking a promotion and getting a raise, those kinds of things. Those are financial costs that have an impact that are a little bit more difficult to measure, but if you look at how it's affecting that individual family, then those costs are high.
Now, Medicare payments are very limited. Medicaid is the biggest payer for long-term care in this country. Let's talk about Medicaid a bit.
Well, in Choices in Tennessee, we have the Choices, the home-based waiver, and it does pay limited, but it does pay for adult day programs. It does pay for in-home care. It pays for transportation, and it also pays for home improvements.
Right, you have to qualify.
You have to
Essentially, you have to
qualify.
pay your life down
Life down, yes.
to a certain level, which is a
Certain
very low level.
Which is hard, and some
Yes.
people can't do it.
Let me ask you, and you can chime in too, Miriam, what is the role of adult day services?
You can drop your loved one off. They are in a safe environment. We do over 20 therapeutic activities a day. We feed them well. And so you know that they are well taken care of. They've got the socialization that they need. And you can go about your own day.
But the capacity, I mean, we don't have enough of these kind of facilities, do we?
No, we don't.
I mean, you cited a statistic before we started talking. What was that?
In 2000, now this is 2015, in 2000, Shelby County should have had 17 adult day programs. And I think we have like 8.
Eight.
We encourage a lot of the caretakers to not only consider adult day services just when they need to take care of an errand or do some type of work activity or task, to really use adult day services for not only their loved ones to be able to take care of their social needs, but for the caretaker to be able to take care of their social needs as well.
Are there support groups for caregivers, and what is their function? What do they attempt to do?
They give you support. I mean, just like they say, you're going to find out that Mona has been where you are now, and she has survived it. But yet, Miriam hadn't gotten there yet. So you can impart. I mean, it's seeing that you're not alone, seeing that there are other resources.
In a way, I guess it's sharing the burden. In a way,
sharing the burden.
You're talking with someone who can understand what you're saying.
Right. You're able to get advice, tips, understanding, and then also it's a great way to get away. You know, it really is. I mean, at the Alzheimer's Association, we've got several support groups throughout the West Tennessee area. So anyone who'd be interested in attending one, we encourage them to call our 1-800 number at 1-800-272-3900. It really is a phenomenal resource.
You know, Chris, the unspoken entity that we haven't really addressed here is neglect and abuse. And many of our patients who require care suffer.
Yes, they do.
Not only from the natural decline of the disease, but there can be unfortunate situations in which the patient does not receive the care that they need. And so by reaching out to others, we not only get good support for those who are doing well, but by reaching out, it's an important bridge to preventing any type of neglect or abuse, because we need to increase support for these folks that are doing, frankly, heroic work, but we need to support them in a heroic way as a community.
I want to talk about the future of caregiving here in America. And I want to touch on something you mentioned earlier when you were talking about the number of family caregivers, because the ratio is dropping dramatically.
Yes.
Right now it's like close to 7 to 1 is what I've read, but in only just a few years it's going to be 4 in 1, and then 3 in 1.
Meaning that there are fewer people that can give care and more people who need
family.
Yes, yes.
So my question is, are we facing a caregiving gap in this country?
Absolutely. I sat down just this weekend with a professional in town, and as we were negotiating, okay, your loved one's going to leave the hospital. You can do hospice, you can do home palliative care, you can do a long-term care facility or a nursing facility, or you can do, and we went down the line of 5 or 6 different choices that could happen. And he sat back with me and he said, I'm reasonably well resourced, I'm reasonably well educated, I have a lot of tools at my disposal. What in the world does everyone else do that doesn't have the resources that I have? And I said, you know, it's a great question. So navigating the choices is quite difficult. And we're facing not only a caregiving crisis, but we're facing an informational crisis. What keeps me awake at night and what gets me up in the morning at Methodist Healthcare is thinking about how do we create a seamless experience for patients and families so that there aren't these sort of, I'm on one stool and I need to jump to another. How do I get across that gap? We need for it to be seamless from diagnosis until the loved one passes, so that people know what the next steps are and they don't have to tell the same story 17 times to 17 different systems. And if we can achieve that in Memphis, we will have done not only caregivers but patients a great service.
But again, you know, we're facing a future with the baby boom generation where in only 15 years or so, 1 out of every 5 Americans is going to be over 65. Yes. And the government already tells us in statistics that 70% of people over age 65 are going to need some degree of long-term care. So we're looking at tremendous numbers of people, and it sounds to me like we're not prepared for that at all.
No, we're not. We're not prepared. We don't have enough. I mean, just talking about Shelby County alone or West Tennessee, we need but we need more facilities and more communities, be it daycare or assisted living or just in-home care. But I think what you said was so important, that we need that information out there, and we need people to understand the information. We do have good resources in West Tennessee, but people don't know how to get there.
There are a number of exciting innovations that CMS or Medicare has undertaken and other insurance payers. Policymakers and population health experts are saying if there's a way that we can prevent hospitalization, we can afford as a healthcare plan, whether that's federal or private, to give lots of great care if we can just think about it differently. Because often there's no question of paying the hospital bill, but we don't pay for caregiving in the home. And so one of the programs that's been very exciting for me to participate in is through some of the Medicare Advantage plans that provide for outpatient palliative care. And so nurse practitioners go to the home, take care of the patient there, and prevent hospitalization. Here in Shelby County, the Aspire program, which is one of those model programs, has shown a reduction in hospitalization of 50%. And so insurance payers really have paid attention to that, and they're saying, hey, we want more patients to be in this program. And so we're looking at ways that we can say, you don't have to make a choice of either or. There's a both and choice that could be made that can reduce costs. Because if we can keep people out of tall buildings, we can save lots of money and we can utilize that care. It's not about taking away resources. It's shifting resources to be more efficient. We can shift this silver tsunami and ride the wave instead of being buried by it.
Are there other countries that do a better job than we do of taking care of people and taking care of caregivers?
Yes, I was a patient in the National Health Service when I lived in Britain. I also was a professional caregiver in the National Health Service. There are many things about the British system that are way different from ours and would not work here. One of the great things that does work well, though, is geographic assignment of outpatient professional caregivers. Each district has a GP or primary care doctor and a district nurse that's responsible for the population of that area. And so this catchment area that they have and taking care of numbers of people in the registry is a way of thinking about care that is non-episodic. It is longitudinal, and it is personal caregiving that frankly works better. The other thing that I think these countries do quite well is that they channel resources into outpatient care rather than inpatient care. If you look at dollars spent versus length of life that's lived, there's an algorithmic curve, and so the more money you put in, up to a certain point, your citizens live longer in the country. There are only two countries off that cost curve, the United States and Russia. So you can drink yourself off the cost curve with vodka, or you can MRI yourself off the cost curve. And so rather than taking Smirnoff in this country, we actually hook people up to MRIs and ICUs and different things. And so we need to get away from the technological imperative that says, oh, we have a machine, let's put somebody on it, into the clinical or the therapeutic imperative where we say, what's best for this patient and this family at this juncture in the illness journey at this time.
I want to close out with your best advice to caregivers. What would it be?
Accept help and to state specifically what you need help with. I need to go to the store. I need you to go to the store. Those kinds of things. There's nothing. There is strength in admitting that you can't do this by yourself. There's strength. There's power in that. And I think that's one of the challenges that most people have is asking for help. And most people want to help. They don't know what to do. So you tell them what you need, and people will do it.
Anyone else?
I think support groups. And the same thing. This is asking for help. It's saying I need that support. I need that education. I need something to help me. But support groups is the number one thing that I think caregivers can really learn from, and it can really help.
Okay.
I would say to remember that your loved one that you're caring for needs a healthy caregiver. So if you're not healthy, who is going to care for them? So you want to make sure that you're not feeling guilty of taking care of yourself, and that's on all facets, emotionally, like we discussed previously, spiritually, physically, in every way, even, planning ahead legally and financially. In every way, you need to take care of your worries, your concerns, your health, so that your loved one can be better cared for by you.
I recently had an experience of caring for my mother, who is now deceased, and I had scores of people who said, I want to help. Is there anything I can do? And I suppose I was waiting for the crisis, and I wasn't specific. And then I thought of things like, I need to do this errand, or I need to do that. And I thought, well, that's too small to ask my pastor, or that's too small to ask my family member to do that. It's beneath them, it's demeaning. It's not. People want to help, but we're never meant to care for our loved ones alone. Reach out, don't be afraid to do that. And if someone's dying to help, let them help.
Well, thank you all for being on The Best Times and talking about this important topic.
Thank you.
Thank you.
Want more information about life after 50? Go to our website, wkno.org/besttimes, and send us your feedback and story ideas to besttimes@wkno.org. That's all for this edition of The Best Times. Please join us next week for more stories about life after 50. Until then, I'm Chris Hardaway. Thanks for watching. Good night. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people since 1964. Additional funding is provided by the members of WKNO. Thank you.